Hi, I'm Dr. Sanjay Gandhi, and we're here today in our clinic to go over the truSculpt 3D procedure for fat reduction. I'm here today with my assistant, Yessie, and a willing patient who wanted to get rid of stubborn fat areas on her abdomen. The truSculpt 3D is an ideal treatment for people who have tried diet and exercise and it hasn't led to the fat reduction that they're really aiming to do. Of course, surgery is an option, as is liposuction, but both of those procedures have downtime associated with them. And this can be done in an hour treatment at lunchtime or during the day, and allows an individual to get back to work right away without any surgical recovery time. So, as you can see with the procedure, this is a procedure in which the skin remains cool, but the fat cells underneath are heated to 43 degrees centigrade. The treatment is divided up into 3 5-minute segments. Say that the first 5-minute segment feels sort of like a mild hot rock massage. Would you say that's true?
Yes.
And the second 5-minute segment would be a warmer hot rock massage. And then the final 5-minute segment tends to get a bit warmer. Usually it's the last 1 or 2 minutes which can get uncomfortable. The nice thing with the truSculpt 3D procedure, in contrast to cool sculpting, is that it doesn't lead to nerve damage or nerve pain. And the other nice thing about truSculpt 3D is it actually leads to skin tightening, which we don't see with cool sculpting. Similar to cool sculpting, we can expect that 25% approximately of the fat in an area will be completely eliminated. The nice thing about the procedure is that it happens quickly in terms of only taking an hour, and but it is a procedure that you need to plan for, because the actual fat reduction happens between 6 and 12 weeks. And so if you're planning a big event, we ask that you come in a couple months earlier than the event to do the procedure. So as you can see, the skin in the area can get a little bit red, but this is a very temporary thing, and over the course of the first 24 hours will resolve. The way that the procedure works is, again, to heat the fat underneath, and gradually that leads to the fat cells being disrupted. It's a process called apoptosis. And then our bodies actually eliminate the fat through the normal processes. It's important that before the procedure and after the procedure that you stay well hydrated and to hydrate yourself. Would you say that so far you've been able to tolerate it? Again, this procedure takes about an hour. We'll oftentimes treat patients midsection initially, and then treat the flanks after that. In this case, our patient is going to be here for a 2-hour treatment. She wants to have both the abdomen treated as well as the flanks, and we'll be able to do that for her. Did you come well hydrated? Did you drink a lot of water?
Yes.
Yeah, for sure. And that's an important part of the procedure, because the success of the procedure relies on the water and being well hydrated. So in this procedure, it's important we tell our patients that they would not expect a completely flat abdomen as if they were having surgery. But the nice thing about the procedure is it's ideal for patients who are interested in having their pants fit better, and also in areas that have been stubborn that perhaps see through or can be seen through their clothes. Of course, diet and exercise is always an important part of life, and all of us are always challenged by that. maintaining a healthy diet and exercising regularly will always help, even beyond any procedure that we do. But this is ideally suited for those people who are always active and just can't get rid of those stubborn areas. So we begin, as we said, at 43 degrees centigrade. Each 5-minute segment, we're increasing the temperature a bit. But as you can see here, in this 5-minute segment, she is tolerating it very well and is comfortable. So we think that as we finish up with our treatment now, you can again see the area that there's redness. We've asked our patient to definitely be well hydrated. And what we like to do at the end is actually to cool the skin. We will take a little roller, and this just feels nice and comfortable to remove any warmth that's in the skin. We'll see our patients back at 6 weeks, and at that time we'll take pictures again, and then again at 12 weeks. Because again, this process works really well to remove the fat, and we like to document that process over the course of the 4 weeks. So thank you again for joining us, and we look forward to seeing you in our office.